I will introduce our speaker tonight, Dr. Benjamin Caplan, who is a board-certified doctor of family medicine and the founder of CED Foundation and the CED Clinic in Chestnut Hill. He completed his medical degree at Tufts University School of Medicine and a family medicine residency at Boston University. In addition to a practice as a primary care and urgent care physician at some of Boston's premier hospitals, Dr. Caplan served as the Chief Medical Officer of CannaCare Docs, overseeing the medical cannabis care of over 250,000 patients, and he has supervised and mentored hundreds of physicians across the United States. Dr. Caplan has served as principal investigator for multiple pharmaceutical research studies and has published in premier medical journals, including the New England Journal of Medicine. He has monitored closely the therapeutic benefits of a living lab with over 12,000 active patients, and he champions the value of an evidence-based approach to bridging Western medicine with the plant therapy ecosystem. So I will share some further information and resources in our chat, where you're also welcome to share your questions as we listen to Dr. Caplan. And then at some point, he'll also give you a chance to join in the discussion with your questions as well. So thank you so much, Dr. Caplan.
Thank you. Hopefully the monotony of my voice won't be too boring and it won't be much of a sleep lecture, but we'll try to keep it interesting. So I'll start off with a couple slides going over the choice topics today, CBD and the endocannabinoid system. If there are questions, I'm eager to hear questions. I think that's how we each take something away. If people are shy to ask questions, there aren't that many questions. I have a secret surprise, I guess, for folks. One of the things that I do is learn a lot from my patients. And one of the ways I do that is to collect information that they teach me. And I have a sample of that information to sort of give people a sense of what it's like to be a cannabis medicine physician. And maybe we can roll through that at the end if there's interest and time. All right, so without further ado, I will share my screen and we can start our talk today. All right. Let's see. Okay. Share this and we'll go into full screen mode. So everybody should see nothing here. And we'll start off, first of all, with a big thank you to the Brookline Adult Community Education. You know, I appreciate the invitation. It's an honor to be here. I also appreciate the work my team at Seed Clinic put together for this. And for all of you for spending your time with me this evening. What people understand about doctors is not always right, although maybe here it is. You know, the experience of being a physician, just like the experience of being a patient, is changed over time. And one thing that cannabis is bringing, not just chaos to the culture, but also a positive change in, I think, the history of medicine. What people know about cannabis and CBD and the endocannabinoid system is also pretty far off the mark. For those who may not know, cannabis has been quite the popular target for misinformation, social and political manipulation for decades. The conditions that cannabis and to some extent CBD can treat are diverse, and the list is pretty long. Just this week, the list of conditions that people address with CBD can be surprisingly ordinary. Although the systems may have us believe that cannabis is only good for treating extreme conditions, The reality is that cannabis is used, and perhaps always has been, as far as we can dig up evidence, for everyday conditions. Although anxiety isn't highlighted as strongly as it should, you know, anxiety, especially around coronavirus, has been a hot topic lately. So how do we get from a seed and an impressively bizarre plant to treating medical conditions like localized pain, stress, insomnia, depression, social anxiety, or simply hacking into feelings of joy and pleasure? That's the endocannabinoid system, but let's cover a little bit about CBD before we come back to the endocannabinoid system and how it seems to work. First of all, CBD comes from the male half of cannabis. Cannabis is a two-part species. It has a male half and it has a female half. As with most species, the female tends to do most of the heavy lifting. And what we know of as hemp in our culture is the male version. So on this slide, on the left-hand side, the one that produces 20% CBD has generally less than 0.3% THC. So not as much the high stuff, but mostly the CBD is the male part. And the female, which produces flowers, has much more of other stuff besides CBD. In addition, they are different plants. The one that has beefy flowers and is producing lots of chemistry is the female. The one that's stocky and thin and good for plants and clothing and fiber is the male. Chemically, they are identical. What you might notice here underneath the big THC and CBD are the chemical formulas, which are identical. What I've circled here in red is the slight difference between the two molecules, which is actually almost interchangeable. If you talk to chemists, there's a good argument that these are actually the same kind of compound. They are interchangeable, which creates an interesting problem if one of them is legal and the other is not. And this just goes to show the immense misinformation or undereducation of the powers that be making the laws about these compounds. The passing of 101 for cannabis, the differences are here. Basically on the left side, the male is low THC, the female is high THC. The male is not psychoactive, CBD is not intoxicating as it were. The female generally is. And then the growing and what they're used for is also there too. Some extra credit, you can see here the clothing actually used to be a major staple of the use of hemp. In the United States, hemp used to be required to grow. It was so versatile and so useful, including the making of the paper upon which our founding documents were printed, was hemp. Okay, bringing it back to the realization of this stuff, CBD and the endocannabinoid system. Most people know about CB1 and CB2. These are cannabinoid receptor 1, cannabinoid receptor 2. These, to most people's surprise, only came into existence in the 1980s. These were discovered in vitro studies and test tubes in the 1980s. And the bigger picture as it's starting to unfold is that CB1 and CB2 are not the complete picture. You know, there are other cannabinoid receptors and things which engage with cannabinoid parts in our body. We have GPRs or G protein receptors, which are actually part of almost every cell in our body. You know, the basic chemistry a lot of us look back on in misery from high school, but learning about ATP, the energy stores of our cells, and cyclic AMP, which turns into ATP. These are things which every cell requires, and they are GPR proteins. So these are things which are critical to all human and certainly most animal life. In addition to the CB receptors and the TPVPs, we have the GPRs. In addition to the GPRs, we have the TRVs. These are transient receptor potential ion channel proteins. These also interact with cannabinoid receptors. So I'll spare you most of the complicated science. I think that's not what people came here for tonight. But there is a complicated science that we're still unfolding. You know, the shocking truth is, despite how prevalent and interested we are in the cannabinoid system and CBD, the mechanism of action, the way these things work in our bodies is still unknown. We understand basics from individual studies, but we don't get the whole picture quite yet, which makes what I'm doing both exciting and shocking. So another way of thinking about the endocannabinoid system, instead of getting too technical, because this is not really aimed to be a sleep talk, let me describe the endocannabinoid system artistically. One of these in this picture was originally meant to describe men and women. Which one, I don't remember, but one of them was simple and the other was complex. But the point I'm trying to make here is really we think about medicines as on and off switches or dials in a way that's artificially simple. Really, it's more of a blend of many different colors, many different complexities, a sort of distribution of chemistry. The image here that I want you to get is we have a foundation of color. On the left-hand side, we have white color and we have blue slapped on top of that, over which things change. So we have maybe a medicine which comes into our body as the light blue. And then if you increase the intensity, we think of it as, well, you get a little bit more intense blue. And then if you have a lot of medicines, if you have really strong sleep medicine, it'll knock you out, you have very, very sharp blue. That's one way of interpreting it. There's sort of layers of intensity, and those equate to different signals. If we think about medicines as disrupting a normal system, the image on the right with red and blue, sometimes medicines work, sometimes they don't work, sometimes you have other things going on, and you don't get the result that you want. I think the way that we think about this, our current model, is just too artificial. We have, as I was showing before, we have different colors, we have different flavors, we have different moods, and these all blend into one another. You know, if you had a meal which was inducing a fast metabolism, the medicine that you took is going to not work as well or not be as strong as it would if you weren't exercising. If you were well hydrated, the medicine might work differently. Or if you had a full stomach, medicines might work differently. These are almost logical, if not common sense. But it's not really part of modern medicine. You know, when a doctor asks you how you're doing, what kinds of medicines might be appropriate, we're not really thinking about the real world. We're thinking about this sort of artificial soup, where this medicine is going to help you feel less anxious or less depressed or help you sleep, as if that were the whole reality, and it's really obviously not. The endocannabinoid system is a layer on top of the soup, which is guiding things toward an equilibrium. It is not so simple as this, but how do we go then from this to this? How do we go from a fluid sort of soup of cross-talking things and different systems to this fascinating plant? The answer is, when you zoom in on the plant, you'll see these little trichomes. They look like little mushrooms. Inside of these is all of the magic and action of cannabis. Inside those little mushrooms are hundreds of compounds. And you can see here CBD is one of them. There's no quiz on this. The idea here is just to get the idea that cannabis is a massive pharmacy of different components. And tonight we're focusing on just CBD, but I want you to at least notice that this is an entire pharmacy. And walking into CVS thinking it's only about toothpaste and toilet paper, you're missing most of the pharmacy. The most common cannabinoids, the ones we're focusing on, well, the one we're focusing on tonight, CBD, is here. And the reason it is interesting for us is because it has these documented medical benefits. You know, people have found it to be helping them with anxiety or with their depression. We're starting to see in Israel that, wait a minute, this might be effective for treating coronavirus symptoms. And wait a minute, it also might be helpful if it's in your mouth to help prevent coronavirus from actually entering. So there's some pretty shocking things we're starting to learn about this. But for tonight's talk, I wanted to introduce the idea that there's this soup and there are individual components of cannabis, one of which is CBD, because even though we're seeing it all over the news, there's a lot of questions I'm sure people have about how to consume it, how to take it. And I think this is probably a good point for us to stop and ask or answer questions. Any questions for now? Is anybody still awake?
I have a question, Dr. Caplan.
Yeah.
Can you hear me?
Yeah.
Yeah. So you had a list of different things that CBD and THC, you would recommend to help alleviate. So like arthritis and pain management would be CBD, but you mentioned TCH for a neurostimulant. And if somebody has a neurodegenerative condition, is a CBD or a TCH something they should consider?
It's a good question. And a difficult answer because it's so thick. There's so many angles to it. When I was talking about those receptors, some of those receptors are implemented in neurodegenerative disorders. So we know on the one hand, if someone has a neurodegenerative disorder, it's probably to do in part with some of these receptors. We also know that cannabis interacts with those receptors, but we don't have direct lines saying this cannabis helps with this disorder, or that cannabis makes this disorder less painful. We don't have that level of specificity yet. We could take these cannabis components and put them in a petri dish, and we can see, yep, they light up when this person has a neurodegenerative problem, and yep, it gets better when they take this mixture. But we can't fine tune it to the level of precision, I guess, that we're used to in Western medicine. Instead of saying this component is good for that disease, instead of that sort of switch idea, instead one can think about cannabis in a different way. So if we assume some of the cannabis is going to be working, we don't know which ones, we don't know how, what we can say is, okay, let's see how can we get all of this cannabis into your body in a comfortable way, and we'll see what happens. If it's uncomfortable, we can change that. If it is comfortable, let's wait and see. And as people wait and see, what they find out is, wait a minute, my illness, my headache, my menstrual cramping, my whatever are getting a little bit better. And we don't have the explanation. We can't say why yet. But science is working on that. Research is coming. But we know from some of the data I'll show you in a little bit, that people just bowled over with joy about how this is affecting. I hope that gets at your question. But please chat or ask me another one if I didn't. So there's a question here. As someone who hasn't taken CBD, where do I start? Do I go see a doctor, or do I go to one of these CBD stores? The person is thinking about anxiety, or are there different subgroups of CBD? So everybody is very excited. All the industry is very excited about CBD. It's legal to produce industrially. The government, to hopefully everybody's shock, actually has a patent for CBD from the 80s being a neuroprotectant. So the fact that the government has come so strongly against cannabis is really ironic, if not horrible. But anyway, CBD is legal, and that's why we see it at malls and at gas stations and everywhere. The CBD, which is legal, has almost nothing else. It's pure CBD. that's in contrast to what we call whole plant CBD. So it's not just CBD in nature. You get CBD, but you also get a little bit of THC, you get a little bit of some other stuff and a little bit of some other stuff. And that whole plant, when we study it, when we say you take whole plant, you take pure stuff, every time we study it, the whole plant works better, almost across the board, no matter what the condition is. So we're in a weird situation now where CBD is legal and it's everywhere. But most of the people around you, if you ask them, they say, it doesn't really work. I don't feel anything. It must be snake oil. It's just a gimmick. And that's in shocking contrast to the people that come into the cannabis clinics. In cannabis clinics now, we're talking about not just CBD, but we're talking about entry into the female stuff, the THC, the CBC, all the letter salad, the other stuff which can be intoxicating. When someone has access to that stuff, in addition to the CBD, the end result is success, that people feel like things are getting better. And again, we don't know why, we don't know the exact formula of what's working, but as soon as you have more than one compound, as soon as you have synergy, these compounds working together, you get better results. So my suggestion, for starting is to get guidance. That's what I do. We have a medical clinic where we're meeting patients one-on-one, just like a regular doctor office. I'm going to learn about you. I'll learn about your medical history. I'll learn about experience, if you have any, with cannabis, and we will piece together a formulation based on what I'm learning from the research, from what I'm learning from my own patients. We'll put together an individual plan that can work for you, because that's really what cannabis medicine is about. It's about one-on-one sort of understanding where you're coming from, what will help you, and helping you navigate the confusion and the complexity of the market. That's really what medical cannabis is. Hopefully that makes sense. Okay, so next question. I've been using CBD for insomnia for about 2 years. It works well most nights, but does not work when I drink alcohol. Is that a common phenomenon? Interesting. So here's a patient who's been taking CBD, which presumably is over the counter, so the legal stuff, and is having success with it. We see that sometimes. I mean, I would say it's about 10% of the time that people who take CBD find it helpful. But this person's question is, it does not work when I drink alcohol. Is that common? So alcohol and cannabis are both processed in your liver. When you're drinking alcohol, it's your liver that breaks it down or tags it to be removed. The same thing is true of cannabis. When you're consuming cannabis, no matter how you're consuming it, your liver is processing it, chewing it up, basically getting it for disposal. When most people take cannabis and alcohol at the same time, they feel amplified effect on both. So if the liver is busy chewing up the alcohol, the cannabis is there a little bit more strongly, and vice versa. If your liver is busy with the cannabis, the alcohol is a little bit stronger. The fact that it's not working when you drink alcohol is unusual. It's not common. I'm not sure how to explain it. I think we would probably think about things like hydration, because one of the things alcohol does is dehydrate you. It takes water out of your system, and that state of dehydration might be affecting the way that CBD is working in your system. But that would be a fun puzzle to work out together. Okay. So another great question, really important question, or comment is I don't want to get high, this person says. Will I get high if I'm taking the whole plant? In the cannabis market, you have complete control over being intoxicated or not. There are people who I see who are never intoxicated ever. They're never high, and there are people who want to be high all the time. Each of us obviously has different state of where we are. Some people are giggly, some people are happy, some people are sort of curmudgeon-y, maybe less joyful. For each of us, our endocannabinoid tone, if we call it that, is different. For some people, one is comfortable. For some people, another is comfortable. Within the cannabis market, which is totally different than the regular medical market, you have control over what you want. You can sort of pick your own side effects. If an effect right now, as opposed to an hour from now, is something you want, you have that choice. If a daytime thing, which is going to be more like coffee, give you some energy, is something you like, or something more sleepy, calming, sedating, you have that choice too. And then, of course, you have the choice to be high or not high. If you are taking whole plant, will you get high? It's more likely because chances are you'll have a little bit of THC. When you have a little bit of THC and CBD, people do feel intoxicated. But I want to take a moment and sort of look at what that means when we talk about being high. You know, we as a culture have talked about cannabis as, oh, wait, you do cannabis? Oh, do you also do cocaine? Do you also kill people? We have this stigma about how awful it is to feel high. And if we take, if we look at that, you know, that's a little bit like, well, it is stigmatizing joy. And I get that it's artificial, and I get that that seems disingenuous. And there are obviously times where being high, for example, if you're driving or if you're at work or taking care of someone, that it's not appropriate. But to label it as something evil, sort of in all circumstances, or bad or undesirable in all circumstances, I think is cutting the conversation too short. Again, this is something you have control over. I think, you know, I think everybody, especially these days, could use a little bit more joy. But I think it needs to be pigeonholed when it's interesting, when it's wanted. And you certainly have that control with cannabis. And before I leave that, one of the magic elements of CBD is actually the compound in our bodies acts as an antagonist. It actually blocks and pushes away the effects of THC. So if someone were to feel high and didn't want to, guess what? The solution is pure CBD. And taking pure CBD turns down the dial, volume down, of how high someone is. Last question, did I say that CBD is maybe preventing coronavirus? So this is a scandalous topic because it's not well enough researched. And it's scandalous in part because it's so exciting for me to read these studies and to see what we're finding out. You know, Forbes picked it up a couple weeks ago. And I actually did a whole webinar. One of the things I do at my clinic is have webinars where we can discuss things just like what we're doing here. We did a webinar about coronavirus. So if anybody's interested, you can certainly watch. I think we put it on our YouTube channel. But basically, there are a couple studies out of Israel that showed comparing standard of care treatment for coronavirus, which is anti-inflammatories, and the strongest of those is steroids. So people with coronavirus were given steroids. That helps calm down the inflammatory response the body has for a virus. One thing we know about cannabis for sure, even before this study, was that cannabinoids, the active compounds in cannabis, work as incredibly strong anti-inflammatory agents. And this study out of Israel was looking at CBD in particular and found that it was 3 times stronger as an anti-inflammatory agent to help coronavirus patients, 3 times stronger than steroids were. It's one study, it's very limited, but it's also pretty exciting and pretty shameful if we think about, sort of from a cultural perspective, the amount of damage and blood on the politicians' hands for having made cannabis and cannabinoids pariahs. So the answer is yes, that coronavirus is helped, in some cases prevented from getting in. But when I say prevented, I'm not talking about the whole illness. I'm actually just focusing on receptors. So when there are cannabinoid receptors in the mouth, this one study showed that it was harder for the coronavirus to implant. You know, someone's not going to stay around with cannabis in their mouth all the time, so it's not a realistic study, but it was interesting nonetheless. Do I work with other doctors? So the next question, do I work with other doctors, such as autoimmune specialists, as a team caring for a patient? How do I choose a strain? I wish that I could work with other doctors. I actually literally wrote postal letters to every single primary care doctor in Massachusetts, opening my door, inviting them to share care with patients. I got some really strong responses, and I have great relationships with a couple doctors. But the truth is, cannabis is still very much misunderstood by doctors. You know, I think most doctors grew up the same way that I did, thinking cannabis was, you know, this sort of terrible thing. It was a stepping stone to harder things and just atrocious. I mean, it was sort of shameful. And most doctors in medical school got an education which was cannabis is part of the addiction world, and we want to teach patients to avoid anything which could harm them, and cannabis is part of that train. So most doctors have not learned on their own. After medical school, that's really the only way to stay up to date with modern medicine is if you're reading on your own. And you know, these days doctors are so overworked that it's very difficult to work a full-time job that's difficult and then also go home and study a totally new subject. So it's hard for doctors to really spend time and learn about it. If they don't feel like experts, they're not likely to engage with it in any meaningful way in their clinical practice. Which is a long way of saying most doctors are not well informed. So it's hard to work as a team, but I do learn a lot from them about the patients that we share. And I do try to get more doctors involved and thinking about at least discussing with their patients that cannabis could be something they would try. You know, one of the unique advantages of cannabis over other medicines, and the reason is it can be legal, and the reason we can put it into the hands of adults almost without doing anything but checking their license, is because it is non-toxic. We don't see deaths from people even when they're taking more cannabis than they should. You know, we don't see deaths attributed. And that's a very special scenario. We don't have that in other medicines. Other questions? Maybe I'm talking quickly. I didn't realize half the hour passed so quickly. I do have plenty more slides, which I think people will enjoy if there's interest. I baited that secret access because it's really a world premiere. I haven't shared this data with anybody. I think it's pretty interesting to be able to see the kind of data and the kind of stories that I'm hearing. Okay. So I'll go through some of the things that I've learned from patients. All right. Okay, so I'm going to share my screen again. There we go. Okay, so these are samples of data that I am taught or I collect from patients. Interestingly, one of the things that I've learned, as you can see here, is, you know, when I ask patients what cannabis varieties do they want, are they all looking to be high? And if you look under probably the 7th or 8th column down, you'll see high THC. Those are people who want to get high. And that's only 20% of the people that come into a cannabis clinic. If you look up above, interestingly, for this topic of CBD, pure CBD products only, you're looking at 5.9%. Or CBD dominant products, because these are people who don't want to be really high, but they're okay with a little bit. That's 10%. You know, so the bulk of people above that, you can see these terms: sativa, indica, hybrid. These are the energy focuses. And one of the problems with cannabis today is these words don't mean anything. There's no such thing as a sativa thing inside the cannabis. It's really how it's grown, the nutrients that makes this plant what it is. But this is the terminology that dominates the market. Which is really sort of embarrassing, but a reality. Okay. Another example of the same data. So who are the patients that are coming in? You know, so we had a couple questions from someone with anxiety and some difficulty sleeping. This is a sample of the patients that I see, just 1,000 responses, 970 responses. But, you know, the vast majority of people that I'm seeing are coming in with some form of anxiety. Particularly now these days with coronavirus, there's a lot of people who are anxious. But you can also see depression as a number 3 here, and then pain. You know, muscle pains, body injuries, menstrual disorders, and and menopausal sort of symptoms are really common. This is another sample, another 1,000 patients. But you can see in this list, I happened to catch a swath of patients with irritable bowel syndrome. So folks who had diarrhea or constipation or sexual dysfunctions. Cancer's on this list too. It's not quite as common as people seem to think it is. And maybe that's relative to the amount of anxiety is out there and the amount of pain. But in the news, we tend to think that cannabis is only for things like cancer and seizures, and that's not the case. I ask people a lot about what's unpleasant about cannabis. I'm not only looking for the good stuff. I want to hear what people are telling me about what they don't like. And these are the things that, you know, when we think about medicines and side effects, you know, what are people telling me? Oh, it's causing dry mouth, or it's expensive is a really common problem in Massachusetts. You know, some things make people sleepy, or it smells bad. You know, so a lot of this actually is avoidable with education. And one of the things that we do in clinic is teach people how to avoid these things over time. What is helpful about cannabis? So for a lot of people, it's you know, as we read down that list, it's helping them relax. It's helping them feel less tense. You know, helping them sleep some. Surprisingly, to some people, it actually helps folks concentrate and feel more creative or feel at peace. And for other people, it's, you know, just feeling less stressed out, you know, feeling calm. More of the same. I'll skip through the next couple, and this one I think will be really interesting for people. How much is cannabis saving costs from other medications or therapies or missed days at work? And here, 66% of people, 2/3 of people think that their cannabis use has saved them from other costs. This is just a sample of 937 people. This one is actually for 790 different people. 75% of people say it saves them costs here. And if you take a second to think about this, this is an industry which is saving 75%. This is what people are saying subjectively. 75% of people think that this has saved them cost. If we dive into a little bit more nuance here, let's get specific. So how much has cannabis saved you? And I asked people about, you know, it saved them a little bit, it's a bunch, maybe it saved my life more than money could buy. And look at these statistics. You know, 15, 16% of people are saying this has saved their life. 100% of their total costs is actually 14.8% of people. These are staggering numbers, and you can start to understand when you see this, when patients are telling me this, I'm seeing the multi-billion-dollar industry. You know, when people talk about it being multi-billion-dollar industry, it's not just people getting high or wanting to get high. It's cannabis saving pharmaceutical, preventing people from spending money on the pharmaceutical industry or the therapeutic industry. It's really shocking. This is another sample, same kind of thing. You know, these results are reproducible. That people, you know, in the 12 to 15% range are thinking this is saving them exorbitant amounts of money. So another angle on that, how much are people spending on cannabis? If they think it's saving them so much, how much are they spending per month? You know, and it's interesting that in the middle ground, there's not too many people in the middle ground here, but people are sometimes saying, you know, roughly 0 to 25. Actually, the top line is people who are new, not spending any cannabis yet. But some people at the beginning, you know, spending not very much, and then a lot of people in the, you know, $50 to $500 a month. You know, and keep in mind, these are not, you know, these are not everyday Joe and Janes. These are people who are in chronic conditions, you know, suffering terribly and probably spending, well, we know that they're spending more money elsewhere. And same kind of data, except this time we got some people in the middle. I'm not sure why that happened. But you can see the general gist is people are spending a good amount of money at the cannabis shops, but they're also saving a bunch for their perception elsewhere. Okay, so this list could go on and on. I don't think we have to spend too much, but I would love to hear what people's thoughts are, or if they have anything to share about that data. Actually, that's information that nobody else in the world has seen. And I have a interesting struggle and joy having that data to myself. And I really wish I could broadcast it on the evening news. Any questions about anything there? Okay, so the question was, what forms do the products come in? I mean, this is so there's a million directions we could go in with cannabis, but basically, I figured someone was going to ask this question. Maybe we're done with slides. So products come in basically topical forms, things you can breathe in, things you can eat, and other. In the other category, we're talking about suppositories, we're talking about eye drops, we're talking about under the tongue kind of drops. The vast majority of people are inhaling or eating. And it's not only smoking, actually. The medical perspective is smoking anything is just destroying it. Not only financially silly, because you're destroying close to 90% of what you paid for, but the act of heating destroys most of what you bought. The temperature is too hot for the compounds in cannabis to sustain, and you end up getting tar and ash and all kinds of mutations that are not healthy. So clinicians in medical cannabis, we're not encouraging anybody to smoke. We're talking about vaporizing. It's a much more precise way of inhaling, or using nebulizers or inhalers, the sort of stuff we think about with asthma or lung diseases. And then edibles, is what you'd imagine, a lot of gummies, a lot of candy. There are some healthy versions, there are sugar-free versions, there's gluten-free versions. And then topicals. Topicals is one of the methods that most people don't appreciate, because they think, how could a topical be much of anything? And this is one area that I think is going to revolutionize our culture. The cannabinoids, all the stuff I was pointing out earlier and showing you, they've developed in the plant world because they block, I think, sort of evolutionarily, I think they developed because they block sunlight. They're UV blocking agents. So of course we can think about topicals as sunscreens. The agents of cannabis, when used topically, have action to help pain. They can be pain relieving and really strong pain relieving agents. They can also be anti-inflammatory. People with radiation burns after cancer or after other radio treatments, applying lotions can be not only soothing but can actually help with the local inflammation. People with acne or skin diseases, even gout, there's inflammation associated with those illnesses, and the topicals can have anti-inflammatory effect locally. Right now, we think of anti-inflammation, we think of ibuprofen, maybe Tylenol, we think of steroids, but now we have a whole other category of options that work. It's going to be amazing. Okay, next question. Where do you see the industry going next besides tinctures and gummies? We have barely scratched the surface of where cannabis can go. I mean, we are like, if we were building a car, we barely understand a bolt yet. The example I gave about CVS, and we're only at like 2 items in the whole store. Cannabis has a booklet of different compounds, and most of the industry is focused on CBD and THC as if that's the only thing in the pharmacy. There are close to 1,000 different compounds here. So I think the industry, where it's going is going to be to revolutionize medicine. I think cannabis is the penicillin of our age. And I think once our culture can destigmatize it and not make people feel bad about using cannabis, we're going to see amazing results. Do I have to worry about drug interactions even when CBD is non-toxic? Yeah. So what I was trying to say before about CBD in the liver, a lot of medicines are digested or processed in the liver. So someone who's taking a dangerous medicine like Coumadin, warfarin, this is a blood thinning agent, which is processed in the liver. If someone's taking cannabis, the action of the Coumadin ends up being stronger. So the end result is you'll need less of it to achieve the same effect. But it can be problematic if someone's not aware of it, or if they're not doing what is recommended normally for someone on that medicine, which is to have regular checks. As far as other interactions, the common interactions people ask about are, well, I'm on anti-anxiety medicine or antidepressant medicine. How do those interact? And the fascinating thing is CBD, THC, all of the cannabis compounds not only interact with the endocannabinoid system that we've been discussing. They don't only interact there, but they actually interact at other receptors too. So we, for example, when we take animals and we knock out their endocannabinoid system, they still have benefit from cannabinoids, from cannabis. And the way we explain that, because we still don't have a complete picture, is that cannabis is acting on other systems as well. And what we know is when people are taking these other medicines, anxiety medicines, depression medicines, that the cannabis tends to work synergistically, works as a amplification of those other medicines. So most people, when they come, they want to get off of these other medicines, and we take it slowly. We see that they're comfortable with cannabis. But I would say between 60 and 80% of people over time, once they are familiar with cannabis and understand how it affects and what's too much and what's too little, once they get it, end up getting off of other medicines or at least lowering doses substantially. Do you recommend CBN for sleep? Yeah, so CBN is one of the, they're all ancient, but it's one of the newer cannabinoids for our culture. When cannabis gets old, all of cannabis turns into CBN. It's a degradation product of cannabis. And it's mildly intoxicating, not as much as its big brother, I guess, or its parent, THC. But CBN is also sedating. It's not knock you out sleepy like Ambien might be, but it is sedating, and a lot of people have found it helpful for sleep. Do I recommend it? Yeah, I think it depends on the individual circumstance. I think there are a lot of people, as we've seen tonight, who don't want to be intoxicated at all. And CBN, because it's mildly intoxicating, is probably not the first choice. But it's a great choice for people who don't mind. And another sad reality is it's sometimes difficult to find. The dispensaries are really in the business of making money. And what that means is they want to make the most money that they can per package they sell. And that means maximizing the THC that they're selling. And that's why we see high THC products everywhere. It's because the investors are really driving the show. They want to make their money back because it's expensive to own and run a cannabis shop. So most of the products end up being THC. It's actually quite similar to back in the 30s when alcohol became illegal. All of the bars around were all about getting drunk. That's what people wanted. And I think our culture's sort of history repeating itself. Eventually, other what we call minor cannabinoids, so CBN, CBC, all the acid cannabinoids, those are other cannabinoids which have sometimes better activity. And those will become more popular and more well produced. But for now, it's a good cannabinoid. I do recommend it. It's just unfortunately rare. And this person also says, I actually used hemp-derived CBN, so you don't get high at all. Seems more like CBD. So actually, hemp-derived CBN is identical to female-produced CBN. The fact that you don't get high at all is also, might say something about your metabolism. That's not the case for everybody, but I'm glad it works for you. And it's one of the interesting things, because the government is only looking for THC stuff now. Some of the other minor cannabinoids like CBN, like Delta 8, THC, it's just another letter salad. Some of those have slipped through the cracks and people are starting to sell those. But I think the FDA, at least a couple of weeks ago, is starting to write letters. They've wisened up a little bit. And those, unfortunately, might not be available for too much longer. That is, of course, until the government gets its act together and we have some form of legalization or descheduling. Other questions, thoughts? What do you recommend? This is a great question. What do you recommend saying to your grandchildren if they see that you have CBD? Is it a gateway drug? This is a brilliant question, because actually I'm a family doctor and I actually treat pediatric patients as well as adults and geriatric patients. I think, parenting is an individual thing. Obviously, I think there are patients that I see who are very open with their family They feel comfortable being open and honest. And, you know, they counsel whatever they're saying. This is my medicine, just like I'm taking my Prozac or I'm taking my other medicines. This is what the doctors ordered for me to help myself feel better. And I think, you know, to some extent that might be taking the excitement out of cannabis. And I think they think of that as, well, if grandma's doing it, then the kids aren't going to do it. I think there's another approach, which is to, you know, to not make it the children's business. And I think that's fine too. I think, you know, we can choose whichever path of parenting we want. I think there are advantages both sides. I tend to favor honesty because I think there's more longevity out of it. I think there's more to learn there. You know, kids are going to have questions, and I think it's better, perhaps, if the parents are available to answer those questions than maybe people who are less interested in the children's well-being. The question, is it a gateway drug, is a brilliant question. You know, it is most certainly not. This was one of the packages that was delivered in the 1930s in Reefer Madness, that you know, this drug was going to get you hooked, and you were going to jump out of buildings, and from a racist perspective, it was couched as making white women seeking relations with black men. It was just all kind of, and it was also an anti-Hispanic sort of agenda. It was unbelievably awful, the way that cannabis was painted. We have strong evidence and longitudinal evidence that shows in areas that have have cannabis use, they're not more likely to move to other drugs. So it's just completely false. I think one could make a better argument that having a bottle at birth is more likely to be a gateway drug to using bottles of alcohol later. Cannabis is not a gateway drug. It does not, it actually might be the anti-gateway drug, because I see people, somewhere between 60 and 80% of people who want to stop using alcohol, want to stop using nicotine, want to stop using opiate medicines. When they're using cannabis, that process becomes easier. So if anything, it's the anti-gateway drug. What made me so passionate about this form of medicine? My parents happen to be in this talk, so I have to be tight-lipped about exactly. But I actually never consumed cannabis growing up. I didn't know anything about it. I was just as deceived as everybody. And I think one day I realized, when my patients were telling me that this was helping them, and I realized that I wasn't taught anything about it, and this was my chance to make an impression on the world. You know, my father is one of the world's most brilliant neurologists. He's an icon in medicine for caring about people and bolstering medicine for the common good. And I saw this chance, cannabis, as my chance to maybe stand out of my father's shadow and make a place for myself where I could really help humankind and move science in a way that is an honor. And I mean, it's pure passion. That is what drives me. Does insurance cover it? It used to. I used to have to fight with insurance companies to cover it. I mean, I'm a regular doctor. We're doing regular medicine visits. It's helping save the insurance company money. They have no reason not to cover it, except that the insurance companies have federal contracts. And part of those contracts say, you as an insurance company can't do something which is federally illegal. And aligning with cannabis in any way, even if it's indirect, has put pressure on them. So over time, they are less interested in covering it. A lot of Medicare and Medicaid patients have had success when using their FSA cards, like these cards that you can pre-tax pay for medical things. Usually they're, you know, if they don't see it black and white, they don't really look too carefully. But it's been a headache, to say the least. Have I had any patients that have had rheumatoid arthritis? Has it helped somewhat? Yes. I would say rheumatoid arthritis and osteoarthritis are some of the most common concerns that people bring to the table. Basically, all of the ailments of aging, if you want to think about it in short terms, are helped with cannabis. No, they're not. It's not a miracle drug. Nobody's you know, dancing in the streets after 50 years of chronic pain. But sometimes it's just moving the needle a little bit. Sometimes it's just one day of peace after 20 years of agony. It's that one day that makes such a big difference. And maybe for other people, it's just dialing down how obsessed you are with this pain. You know, it's not just carrying the groceries. It's not just washing your hands. It's not just writing. All of these things add up, and there's a suffering around that, which is grueling. And to have a medicine which works, you know, not just on the arthritis itself, but also on the sort of psychic element above that pain, the suffering, the sort of, suffering is the best word. It's really, to dial down that suffering is so meaningful, that really makes joy for people. And once they're feeling joy from not being in constant suffering, you know, that becomes a fulfilling process. So we have short time left, and I'm not. Thank you. I'm not one to really, you know, broadcast my own. I think the mission that I have is really to teach people and help people understand what I see. For people that have interest in coming into the clinic, I'm excited to see people and talk one-on-one. You know, the address to do that is my website, cedclinic.com. It's an education website. It's not intended to be for marketing. There are handouts, there are videos. You know, if you're interested in learning more on your own, it's a great resource. I've actually pooled the world's archive of cannabis literature. It's the largest database in the world. And I put it onto a Google Drive that anybody can search and read for free. And that's on the webpage too. Everything that I do on social media is translating that archive into jargon-free language, so everybody can speak the same language, understand what studies are coming out and what it means. And you know, if people have social media or have interest in that, you're welcome. Everything I do is free for the public, except for the clinic. That part's not free. But anyway, I would love to help anybody who's been interested, intrigued by what we're talking about tonight, or folks who are watching the video. Everybody's welcome. All right. Jackie, thank you again for the opportunity.
Thank you, Dr. Caplan. This was so fascinating, and I will be happy to help anyone get in touch with you if they need to.
Thank you so much.
Yeah, thank you.
Take care, everybody. Have a great night. Stay safe. Wash your hands.
We will. Thank you.